Assalamualaikum. Today I will present about mental health conditions among students during pandemic Covid-19, a study among university students in Kedah, prepared by Mohamad Ramiesyahmir bin Ramle and Wan Nur Adila Sofea binti Wan Hamezamly. The exponential increase in COVID-19 cases in Malaysia following a community outbreak related to a religious mass gathering in Kuala Lumpur prompted the government to take a major step by implementing its first ever set of nationwide lockdown measures, known as the Movement Control Order (MCO), on March 18, 2020. Movement control order due to the COVID-19 pandemic can have several impacts on the economy, business and society. It comes as no surprise that the pandemic has affected many lives globally, forcing everyone to accept a new norm of masks, SOPs and lockdowns. According to Young and Joseph 2021, the COVID-19 pandemic has significant impacts on society's well-being in Malaysia, the most severe of which are negative mental health and job unemployment. On the other hand, COVID-19 has sparked a surge of volunteering in society. During MCO, where most schools and universities must shut down their operation due to the COVID-19, online learning has been seen as a platform where educators can share their knowledge with the students. These impacts include social distancing, quarantines, isolation measures, campus closure, border closure and travel restriction. According to research from Moy and Ng 2021, have found the stress level was higher in their study, which was conducted during the COVID-19 pandemic. The prevalence of depression, anxiety and stress among Malaysian undergraduate students ranged from 13.9% to 29.3%, 51.5% to 55% and 12.9% to 21.6% respectively. The workload of university students has led to mental health problems. Another finding by Sun et al. 2020 have found the effect of COVID-19 on college students' class workload was inconclusive, although slightly more than half of participants said their academic workload had increased. Because of COVID-19, the rest said it had remained the same or had decreased. As stated by Mikolaj et al. 2008, sudden adoption of these online services during the pandemic may have some effects on students' lives, as there are several issues that may hamper and demotivate many students during the learning process. Being under a lot of pressure to perform academically, students are also prone to developmental health problems as their social isolation. Next, I will explain about research question. Firstly, what is the level of mental health condition during COVID-19 among university students in Kedah? Secondly, what is the relationship between online class and mental health conditions during COVID-19 among university students in Kedah? Thirdly, what is the relationship between academic performance and mental health condition during COVID-19 among university students in Kedah? Next, what is the relationship between financial hardship and mental health condition during COVID-19 among university students in Kedah? Other than that, what is the relationship between routine changes and mental health conditions during COVID-19 among university students in Kedah? Lastly, what are the most influential factors that affected mental health conditions during COVID-19 among university students in Kedah? For research objective, the first objective is to study the level of mental health condition during COVID-19 among university students in Kedah. Secondly, to study the relationship between online class and mental health conditions during COVID-19 among university students in Kedah. Thirdly, to study the relationship between academic performance and mental health condition during COVID-19 among university students in Kedah. Next, to study the relationship between financial hardship and mental health conditions during COVID-19 among university students in Kedah. In addition, to study the relationship between routine changes and mental health conditions during COVID-19 among university students in Kedah. The last research objective is to study the most influential factor that affected mental health conditions during COVID-19 among university students in Kedah. For conceptual framework, mental health conditions are the dependent variable in this study. There are 4 independent variables, which is online class, academic performance, financial hardship, and routine changes. In research methodology, for research design, the researcher have using quantitative method through hypothesis testing, and unit or level of analysis is from students of University Technology Mara and students of University Utara Malaysia. The sample size of this study is about 384 students, while sampling technique is simple random sampling. An overview of questionnaire consists of 6 sections, which include Section A, demographic profile, Section B, mental health condition, Section C, online class, next Section D, academic performance, Section E, financial hardship, and Section F, routine changes. Lastly, for data collection, the questionnaire was distributed through online. Next, I will explain the findings of this study. Finding for research objective 1 is to study the level of mental health conditions during COVID-19 among university students in Kedah, which is descriptive analysis. The result is mean score 4.37. The decision is the level of mental health condition during COVID-19 among university students in Kedah at high level. For discussion, most students have high level of mental health condition during COVID-19 among university students in Kedah. According to a national survey done by the Ministry of Health, 1 in 3 Malaysian adult aged 16 and older have a mental health condition, up from 11.2% in 2006. In Malaysia, 13 to 17 years old experience depression, 2 in 5 experience anxiety, and 1 in 10 experience stress. 10.1% of young people have attempted suicide, which is alarming. For research objective 2 is to study the relationship between online class and mental health conditions during COVID-19 among university students in Kedah, which is correlation coefficient. The result is R value equal to 0.579 and P value equal to 0.000. For the decision, there is a medium positive relationship between online class and mental health conditions during COVID-19 among university students in Kedah. For finding, H alpha is accepted. There is a significant relationship between online class and mental health conditions during COVID-19 among university students in Kedah. For discussion, the result obtained is parallel with previous study by Sun et al. Surveys effect of COVID-19 on college student mental health in the United States 2020. Most respondents were worried that the pandemic would affect their academic performance. The change over to online classes was thought to be the most challenging. Participants expressed particular concern about the difficulty of learning online, the quality of the classes, and technical problem with online application. Next, for research objective 3 is to study the relationship between academic performance and mental health condition during COVID-19 among university students in Kedah, which is the analysis is correlation coefficient. The result of this research objective is R value equal to 0.502 and P value equal to 0.000. The decision is there is a medium positive relationship between academic performance and mental health conditions during COVID-19 among university students in Kedah. The finding is H alpha is accepted. There is a significant relationship between academic performance and mental health condition among university students in Kedah. For discussion, the finding is supported by Sun et al. 2020 found that the effect of COVID-19 on college students' class burden was ambiguous. In their study, effects of COVID-19 on college student mental health in the United States. Research objective 4 is to study the relationship between financial hardship and mental health conditions during COVID-19 among university students in Kedah, which the analysis is correlation coefficient, and the result is R value equal to 0.544 and P value equal to 0.000. The decision is there is a medium positive relationship between financial hardship and mental health conditions during COVID-19 among university students in Kedah. The finding is H alpha is accepted. There is a significant relationship between financial hardship and mental health conditions during COVID-19 among university students in Kedah. And the discussion is the finding is supported by previous study found that being in a financial challenge, it also stirs up all kind of psychological issues. The stress of losing a job can take a heavy toll of someone's mood, relationship, and overall mental and emotional health as stated by USNI 2020. Research Objective 5 is to study the relationship between routine changes and mental health conditions during COVID-19 among university students in Kedah, which the analysis is correlation coefficient. And the result is R value equal to 0.459 and the P value equal to 0.000. The decision is there is a medium positive relationship between routine changes and mental health conditions during COVID-19 among university students in Kedah. For finding H alpha is accepted, there is a significant relationship between routine changes and mental health conditions during COVID-19 among university students in Kedah. And discussion, the finding is supported by World Health Organization. There are few studies have highlighted the after COVID-19 on how infectious diseases affect lifestyle, mental health, and quality of life. The last research objective is to study the most influential factors that affected mental health conditions during COVID-19 among university students in Kedah, which the analysis is multiple regression analysis. And the result is standardized beta value equal to 0.297 and the P value equal to 0.000. For discussion, there is a medium positive relationship between routine changes and mental health conditions during COVID-19 among university students in Kedah. While for finding H alpha is accepted, there is a significant relationship between routine changes and mental health conditions during COVID-19 among university students in Kedah. The discussion is this study aligns with previous study by mental health effects of online learning on 2021. The mental health of students, parents, and even teachers is impacted by taking online classes. People who already have mental health problems may see their symptoms get worse. There are few recommendations for improving this study for future research. For the first recommendation is conduct varied research design. This is for future researchers to employ a new study design, such as mixed method study. A mixed method study is one in which researchers gather both quantitative and qualitative data in the same study. Although quantitative methods are useful for testing and validating existing theories, qualitative approaches may provide more in-depth understanding for this study, enabling researchers to explore different viewpoints and uncover relationships that exist among complex layers of various research questions and more completed answers. Second recommendation is analysis the respondents' dynamic. This is because the study time is limited. The researchers must have researched which sort of group is free to answer the question. As a result, before deciding on the final topic of study, the researchers should select the ideal target respondents to be chosen. For example, before finalizing the title, contact the intended respondent. The researchers should have tried to be more strategic in their preparation so that their study does not appear rushed to the respondent and they can react with clarity. Such limitation may arise during the process of this investigation. The first limitation was imbalance based on the gender of respondents. Mental health conditions among university students in Kedah could not be correctly determined since male respondents outnumbered female students. Most respondents in this study were male students who recorded about 56.2%. In addition, the female students accounted for about 43.8%. As a result, comparing mental health conditions between genders among university students was challenging, since the data might be imbalanced towards the male gender due to the smaller number of female respondents. Second limitation is global pandemic constraints. The questionnaire was provided to all students online. Respondents were likely to fill out the questionnaire forms, prompting the researcher to promote it throughout all social media platforms. There is no uncertainty that physical observation may provide accurate and exact information about the respondents' information, as well as the respondents' interpretation of the real scenario. However, because university students were supposed to have a blended learning experience at the school, researchers were unable to acquire valid information through observation. As a conclusion, based on the result obtained, there is a significant relationship between all the variables, which were online class, academic performance, financial hardship, and routine changes towards mental health conditions during COVID-19 among university students in Kedah. Overall, this chapter describes the study limitation based on the data collection procedures as well as the ideas for future research improvement.